Hi, I'm Dr. Jenny, and thank you for joining us on another couch conversation. And today I'm talking with the amazing Brooke Watts, who has just become an incredible advocate for women from regional New South Wales, women with endometriosis and chronic pelvic pain. So thank you for joining me, Brooke.
Thank you for having me.
Can I get you to just start by talking a little bit about your story and how we first met?
Yeah, definitely. So we met 5-ish years ago. Feels like a lifetime, but also feels like just yesterday. So my story with chronic pelvic pain definitely started a long time before that, but I think you've played a big factor in that over the last 5 years. So I had a lot of pain from my early teenage years with my period, very heavy periods, a lot of pain, a lot of emergency trips. I knew that something was wrong, but I didn't quite understand what. I don't think it was commonly talked about at school or within friend groups or even within my family. And I was very openly dismissed up until the age of about 20. And
I guess your mother probably took you to your GP on several occasions to say, my daughter's missing school, she's in a lot of pain.
Yeah.
What was the message that you got out of that?
I had multiple times that it was dismissed as just being dramatic, that I had anxiety and that I wanted something to be wrong, that it was just a normal period. I remember sitting at emergency on the floor crying and just bleeding through absolutely everything, and they said, nothing's wrong. And I never had an ultrasound up until the age of 20, and I had been begging for answers for years and years and years, and I was told it was all in my head, nothing to worry about. And I think we're raised to trust the medical system. And, you know, my mum, my dad, my sisters, anyone who came with me, they're the exact same, and I have nothing against them, but that's what we're taught, is if a doctor says that there's nothing wrong, there is nothing wrong. You're not taught to challenge the system. And I think once I turned 20, I had something shift in me, and it was just, I think it came from a place of pure exhaustion, that I was like, no, something is wrong and I know it. So I had a new GP open in the town about 30 minutes down the road from me, and they were bulk billing. So I thought, I've got nothing to lose. There's no cost to me. I'm just going to go in. And I remember my family saying to me, something shifted that day. And I went in and I just thought, I'm not going to take no for an answer. And I had a girlfriend at the time who I was working with very closely, who had ironically just been in to see you, and she just had some endo removed. And she said to me, Brooke, you have endometriosis. And I was like, I have no idea what that is. What the heck are you on about? So I went into my GP and I said, I think I have endo. If not, something else is wrong. I really want an ultrasound. So he sent me for an ultrasound. And I remember getting in to see the ultrasound clinic maybe a week later, and the ultrasonographer was doing the scan, and I know they can't tell you anything in the scan until it's reviewed.
You could tell there was something.
But her facial expressions were just shocked. They were blank. And she just said to me, it's the right side you have the most pain. I said, yeah, but like it's also just widespread through my pelvis. And I remember her just saying, you need to see your specialist ASAP. And I walked out of there, and I could see on the imaging there was a big mass of some sort, but I didn't quite understand.
And you were a 20-year-old by yourself.
Yes.
Who had been dismissed since you were 12, really? Is that right?
Yeah, 100%. So following my scan, I went in to see my gyno that I'd been on the waiting list for. And the only reason I got in sooner was that they'd had a cancellation, and they called me and said, do you want to come in for an appointment? I said, yes. Headed in, and I remember sitting there alone, and he said, you've got a 8-centimetre dermoid cyst near your right ovary. We're going to go in, take the cyst and potentially take the right ovary, but I think that's the best option. And me being a naive 20-year-old female who had no idea what she wants in life, no idea of the research around it or anything to expect or what I was even getting myself in for, I agreed to it. And I'm never going to say that I didn't know what was happening. I did know, but I had such a lack of awareness of what the implications of that were.
Yeah.
So,
and you said to me, you made it very clear that fertility was important and that having babies later on was important. And you asked the question, will my fertility be okay?
Yep, 100%. And
you were given an answer.
And I was told that my age wouldn't affect anything. And now since meeting you, I know that age affects quality, but it doesn't necessarily mean that you have quantity in every single case. So I went in for my surgery. I had my ovary taken out. And after that, I didn't I was so ashamed that something had happened to me and my body didn't react the way that it was meant to for a normal 20-year-old female. And I thought, like, a big piece of my womanhood is missing. Like, I'm not going to be normal again. And I didn't tell I told my family and I told my good girlfriend that I was working with at the time and my bosses, just because I had medical leave. But other than that, no one even knew that this massive life-changing event had even happened in my life at the time. So following that, I had a lot of complications with pain coming back, and through my bladder, I knew that something wasn't right. Again, went into emergency, had troubles going to the bathroom. I was going into chronic urinary retention and eventually got referred to see a urologist in Sydney. And after I had my urodynamic testing done, which for anyone who doesn't know, it's basically a lot of sensors put into your bladder, measuring the capacity that your bladder can fill to and how well it empties. So after doing that testing, that procedure, they discovered that my bladder is essentially like floppy bladder syndrome and will overextend, but it doesn't have the nerve function anymore to retract.
And if I was to just backtrack a little bit, you had your right ovary removed for a dermoid cyst, and that is categorically not what you do. There is always normal ovarian tissue which can be found. You can remove the cyst and preserve the normal ovary. You didn't need to have your right ovary removed. And in fact, the dermoid cyst wasn't what was causing the pain. What was causing the pain was the endometriosis, which was left behind. And with your bladder, in fact, what had happened there is your bladder had been overdistended after the operation, and that's what's caused the ongoing problems with your bladder.
Yeah.
Which is something that you've had to learn to live with as well.
It had massive life adjustments because post-surgery I was down an ovary. I didn't have the cyst anymore, but I hadn't noticed a huge effect from that.
And
but
I still
had the endo pain, and then now I had added bladder complications that I didn't have before.
Yeah.
And now I'm about to, as of tomorrow, go in for my next surgery for more complications for a sacral neuromodulator in my back that now essentially functions my bladder for me because I don't have that nerve function. So at the same time that I was sorting out my bladder issues and getting my diagnosis for that and doing my trials for this device sort of overlapped with when I first met you. So yeah, that was 5 years ago, and I remember coming in and just your approach was so different to anything I'd seen before. I think it came from a whole body understanding what was going on, all of the different factors that were affecting it. And
I just remember that this 20-year-old woman, this 20-year-old girl came in, and you'd really been through a lot. You'd lost an ovary, and you had this chronic pain from the endometriosis. There were fertility issues to talk about. There was a lot of things to talk about, and there was the bladder symptoms that were slowly being sorted out by a urologist. I know that you came to know and really trust and have a lot of you continue to see her. I know that.
Yeah, and I think for me, it was ticking off one thing at a time. And in my head, I thought, I'm going to fix my bladder and then we can fix endometriosis and then we can look at fertility and we'll fix that.
I remember we had to break it down.
Yeah. I think I was a little bit of an overachiever. I thought that everything was going to be solved. I didn't have an understanding at 20 of what chronic meant. I didn't know this stuff's with me for life. It doesn't go away when, you have a good night's sleep, or if I eat and drink my vegetables and water and this and that, I'm not going to be fixed. It doesn't work like that, unfortunately. So
it all helps.
It helps, but it doesn't fix it. I wish it did. And so we headed in for our first surgery together, and like you said, we broke it down. I think that first step for us was checking for endometriosis, because after my first surgery with the gyno who removed my ovary and my cyst, there was no mention of endometriosis. And in my head, I knew there was something. So I think, that was our first step, was to go in and do surgery, and you removed pretty widespread endo at the time.
And we would have talked about putting in a Mirena.
Yes, that's right. So
a Mirena is generally a very effective modality to minimise the risk that endometriosis will come back. It's generally a very effective modality, but I remember very well you had a really difficult time with irregular bleeding afterwards and heavy bleeding, and we ended up taking it out and looking at various other modalities to suppress it.
Yeah, I feel like we've been through every
I think we
birth
have.
control method possible, every type of hormone.
Yeah.
So we'd done endo surgery, we put the IUD in, we took the IUD out, and then since then we had another endo surgery, and then more recently we started looking at fertility testing. Can you run us through, because I was so naive when it came to this, what sort of, if I'm someone who's starting to look at my fertility and I'm a bit unsure of where to start, if I was to head to my gyno, what do I ask for? What do I need to get tested?
The first thing that I would have said to you is that we recognise the fact that you've got a lower egg count, but I saw you when you would have been 22 when we first met, and a 22-year-old woman is going to have good egg quality. It is absolutely age that drives egg quality and drives fertility. So that's very reassuring. But to do a more thorough assessment on top of that, there's a blood test called an AMH, an anti-Müllerian hormone, which gives me a very good idea about your ovarian reserve, and that told me that it was lower than what I would have expected for a 22 or 23-year-old girl. An ultrasound, a good quality transvaginal ultrasound, will look at what we call the number of follicles in the ovary. There's no standard graph that tells me how many that you should have, but I always say I look at this often enough that I can eyeball it. And that told me also that your ovarian reserve, or the number of eggs that you've got left, was low. Look, on top of that, I do a whole heap of other investigations like thyroid function tests, various other hormones, androgens, prolactin. We do all the antenatal testing like immunity to rubella and chickenpox. We do everything. And I always say to women, I want you to have a clear understanding of what the tests that I'm doing and what they mean. I want you to have the opportunity to ask all the questions that you can. And I always encourage women to, if they can't think of questions, to write things down afterwards and I can answer them later on.
Definitely. And I remember after doing those tests with you, I feel like it was a no-brainer in my journey, but we opted to do an egg freezing cycle. Can you run us through what that looks like? Because again, I feel like I've just been learning as I go, and you're the biggest mentor I've had in this space. What is egg freezing?
You know what? It's been a pleasure in the nicest way possible to be on this journey with you, because I admire the fact that you're so motivated and you ask the right questions and you're helping other women. I admire that. Egg freezing is really a viable option for young women to preserve fertility. I can never say that it's a guarantee of pregnancy, but it's a good insurance policy. Essentially, it is the first 2 weeks of an IVF cycle. So I give you injections over about 10 to 12 days to stimulate a whole group of follicles, to stimulate a collection of eggs, if you like. We do tracking for those 10 to 12 days that might consist of 3 visits to do a blood test to largely look at your estrogen, but to look at other hormones, and an ultrasound to look at the growth of the follicles. And I can use those to pinpoint when we're ready to do the egg collection. So there's various, I would advocate doing the egg collection under sedation, but I'm well aware that it can be done under local anaesthetic or by breathing a gas, but I would personally advocate doing it under sedation. It takes 5 minutes. I put in a transvaginal ultrasound. I get up a picture of, in this situation, the ovary. In other situations, both ovaries, and I can direct a needle into the follicles, drain the fluid and collect the fluid, and then a scientist who is in the theatre at the same time looks at the fluid under a microscope, finds the eggs and counts the eggs, and then they go off to the lab and they're frozen.
Yeah, that was a whirlwind of an experience for me, because I feel like I'd seen it on TikTok and Instagram Reels and this and that. I didn't realise how well supported, though, I was going to be. I had regular check-ins with each of your admin staff and the nurses. They're absolutely beautiful.
I work with an amazing group. of professionals. The nurses are beautiful, and we always say no question is too big, no question is too small. Just ask. I think what we say is just use us as your Google, use us as your Dr. Google. Ask whatever you want. And the admin staff are beautiful as well. They're always there on the end of the phone to answer any question you've got, just to make things a bit easier.
Definitely. I think I have Jade saved in my favourites on my phone. The poor thing hears from me way more than she needs to, but she's beautiful.
She would do it with love, I'm sure.
She would. She takes customer service above and beyond. I remember when I was at your clinic last time, and I was just having a shocker of a time after a very poor experience at my local regional hospital, where I was just completely dismissed after passing massive clots and a vomiting episode nonstop, and I knew something was wrong and not right.
Yeah.
And I had a doctor, not even the nurse. The nurse that I had at first was absolutely beautiful, but when I eventually saw the doctor, she looked me dead in the eye and said, "Do you understand pain levels?" And I said, "Yeah, I have chronic pain. Like, if I'm feeling pain and I'm asking for help, I'm telling you something is wrong. I'm begging you. I don't sit here for 8 hours waiting to get treated because something's not wrong. Something is wrong." And she said, "Oh, but because you have chronic pain, you just assume that everything's the end of the world."
And that's called gaslighting.
Correct.
And you've been there for many years. And like I say, you've become an advocate for other women, and you know you're down, you're at your weakest at that particular point in time, and you've got someone telling you that you don't know what you're talking about. I feel like you would be able to handle yourself much better than someone else who is younger, who hasn't been exposed to what you've been through. But why should they? Why can't we just listen to what women are telling us? Why can't we just take it seriously? It upsets me to no end that you went through that, and that I know other people go through that.
Unfortunately, it's such a common occurrence, and I think particularly in regional areas, we wait so long to access care. The wait list to get into specialists is absolutely ridiculous. Even the wait to get an ultrasound at times is so insane. And to sit in an environment like that where you get completely dismissed, overlooked, like I look back at, even 16-year-old me, and I would go, "Oh, okay, no worries. Like, can I just be discharged? I'll go home and I'll take some Panadol." Versus me now, and I have people who say to me, "Why are you so fired up about this? Like, why are you an advocate for this?" Because we shouldn't have to be advocating for ourselves. I shouldn't have to be sitting here with a diagnosis of complex PTSD and about to go in for my 14th surgery tomorrow. That's not on at all. So if I can use all of this to make change and even just make these conversations a bit easier, or something like this, sharing resources of what to ask for, it has a purpose, and I'm going to use it for that. And I remember being a guest on another podcast about endometriosis, and I can't remember who said it, but they said if it's uncomfortable to listen to, imagine living with it, because that's uncomfortable. And I still have some people who look at these conversations and like, "Oh, women's health, like it's still a bit taboo," and they're like, "Oh my goodness, periods, yuck." Guess what? Every woman in your life faces it. And what is it now? 1 in 7 women in Australia getting diagnosed with endometriosis, whether it's you or your partner or your mum or your sister, or you know someone. Even if it's a girl in your workplace, if you can listen to a conversation like this and just understand where they're coming from, we can make the world a little bit of a kinder place, I think. And there's so many wonderful people. I have males in my life who are absolutely beautiful and try and understand it, and females who are living through it and looking for support, and yet we still walk into a medical system that completely dismisses it. It just baffles me. Yeah, so the recent podcast that I went on for Let's Chat Endo is founded by a lovely friend of mine, Hayley Jean in Orange, and she's got a podcast sharing stories of women living with endometriosis and also healthcare professionals sharing their insights on endo. And earlier this year, she reached out to me and said, "Oh, I would love to do an event where we could have women come together in Orange to chat about endo." And we honestly pictured maybe 12, 15 people getting a coffee in Orange going, "Yeah, this is pretty shit. Hey, you have what I have." And suddenly we started planning this event for Orange, which just grew beyond anything that we could have ever imagined. And we had 50 women and 1 male. Credit to him. He was incredible. And they all came to Orange for our first Let's Chat Endo event in March in Orange, which was a room that was so special. The vibe was absolutely electric, and you could sit there, and we had a panel full of speakers who all lived with endometriosis. We had a lady who does acupuncture. We had a nurse from the endo clinic in Orange.
Amazing.
We had Kelly from Cozy, who has the 360-degree wraparound heat pack. We even have Tanya Hennessy come in. But yeah, it was just an absolutely incredible vibe. And
wonderful.
So surreal that in a regional area, there were women coming that I knew or knew of, that I went to the same high school as me, and this and that I've seen down the street in my local town, and suddenly they were all coming to this event and they've got exactly what I've got. Yet when I was first going through it, I didn't think that there was anybody like me. And the fact that now I can create these events is just incredible. And then we had a recent one in August for a coffee catch-up, which was just a much smaller style event to share some resources and stories, and it got a whole new demographic. There were 10 extra girls there who hadn't even been to our first March event. So these conversations, they're just growing so
That's
rapidly,
wonderful.
which I think shows the need for it.
And can I ask, you said that there was one man who went. What was his story?
He went with his girlfriend and she didn't even ask him to. He said, I just want to come. I want to support you. I want to understand it. And whilst we talked about everything, and when I say everything, I mean everything. We were talking about the impact of endo on the bowels, painful sex, heavy periods, most embarrassing period stories, coping strategies, the toll that it takes on your mental health. There was nothing that was off limits at that conversation, and he took it all on board just so that he could be there and support his partner the best way that he could.
Yeah. Yeah. And I gather he would also go along to all the appointments and everything.
Yeah, which I think's really important. And I know looking back on 20-year-old me, that's one spot that I went wrong, was that I was very stubbornly independent, and I still am, I will admit. I do a lot of my appointments alone.
You do?
But
I don't know that I've ever had an appointment with you with someone else, now that I think about it.
my mum's come to one. I remember her sitting in one.
Yeah. Oh, you're right. Sorry, you're right. I remember that now.
My sisters have both been to some, and I remember them sitting in the waiting room because Jade got them some popcorn and they loved that. After a good 5-hour drive, they're keen for a snack. And my dad's come to a couple, but I've always parked him down having a coffee, doing some emails and work phone calls
in
and
the
things.
food court.
Why do we think it is that men don't want to be involved in this conversation?
I think for a lot of males, my dad had 3 girls and a wife. He's been around this for the last 20, 30 odd years, and he's very used to it. I think for people who haven't had that conversation before, it's hard to hear. And I know even male friends that I have in my life, it hurts them to know that I'm facing something that they'll never feel. And there's a certain element of resentment that I feel towards my friends or family or anyone in my life who doesn't feel the pain I feel, because they try and sympathize, and I get that. I fully respect that. But until someone feels it, you don't know. You have no idea. And I think for males, sometimes it can become a little bit of an ego thing, plus just a defense mechanism that they feel so guilty that they don't understand and they can't, and they don't even know what a normal period feels like, let alone having chronic pain and, the inflammation that you've seen on my cervix in surgeries and widespread endometriosis. It's so much for their head to wrap around, but also it's not a conversation that we're having. I didn't know what endometriosis was till I was 20. I know now there's a bit of work in schools.
There is. There are programs to go out into schools to talk about heavy, painful periods, just to make girls aware of what is normal and that help is available.
Yeah.
And that they don't have to normalise it. And I think in years gone by, girls were taught to normalise it.
Yeah.
Yeah.
Even when I was in school, which it makes me feel old, but that was nearly 10 years ago. I feel like I finished school yesterday. It was not a conversation we were having. I remember in PDHPE or whatever that subject was called, periods were something that we just skipped over. And they went, okay, this is a pad, this is a tampon, this is how you put a condom on a banana. And then suddenly you moved on to sport and physical health and mental health and this and that. And it was something that was you're just tipping the surface of it. And at the same time in school, they're teaching you everything to not have a baby. They don't have the conversation
about fertility. And so that's the other thing. You spend as a teenager in your 20s talking about contraception, And then suddenly having a baby becomes something that you think about in your 30s, and we should be thinking about it earlier.
Yeah. I see so many memes on Instagram that say my two biggest fears is getting pregnant but also infertility.
Yeah.
And it's true, because you have this transition period where suddenly as a teenager your biggest fear is having a teenage pregnancy, and then suddenly you go, I don't want to be pregnant, but what if I'm infertile?
Yeah.
And then suddenly your biggest fear is infertility.
Yeah.
Whereas it needs to be that conversation that, like you've said, age determines quality. If it's something that we can intervene earlier as we need to. And I think that's where I find myself grateful that we met when we did. And like, if we were just starting this journey now when I'm 26, that would have been a completely different outcome versus we started the conversation early. I had time to consider my options, and there's a lot of thinking time that I have. We don't rush into anything.
No, and there's so many times when you come in and you go, and I think there's a young woman who is really being forced to think about things at an earlier age. Like, we've had a talk about having babies, and really I've had to ask you about your time frame to really get you to think about it. I think I always say I can ask the questions, I can put the questions out there. You may not have an answer for me, but it's just something I want you to think about in the back of your mind. Would you be prepared to do it by yourself? When you meet someone, in the back of your mind, how is that playing into what you're thinking and, you know, what you talk about and how you see the future of that relationship?
I think it's something that, like you said, we've had some pretty raw conversations, and it's something that I never in my wildest dreams imagined that I would be seeing a gynecologist for something other than the excitement of having a baby.
Yeah.
That was nothing that was ever on my cards. Nothing could have prepared me for it. Going into it as a single person is such a different scenario to if I was 30 and married and ready to have children. So it's one thing for me to face it on my own. And I say face it on my own because I have a great support system. My family are absolutely incredible. Some of my friends are amazing, but I'm also very wildly independent in just a stupid, intolerable way that I share my load across my friends and my family. There's not one person that I put all of this onto because I feel so much guilt. So I take everything on my own shoulders, and I don't want to burden someone else with that. And I know the right person comes along at the right time and they'll put up with it. But as a 26-year-old dating, how do you navigate that conversation? I don't know. And I've tried dating and I've tried mentioning it from the get-go of, hey, I'm in a really tricky situation. This is what it looks like. But on the opposite end of the spectrum is it's not something that you can hide and then drop as a bombshell once someone's emotionally invested. So I think it's something that's very case by case to navigate. And even disclosing it to friends, I have certain friends who always say the right thing. And then I have other friends who are great for being a support from a distance, but I know I'm not going to have a deep and meaningful with them, because some people, and for anyone who's listening who wants to help someone with chronic pain or endometriosis, my biggest piece of advice, do not give them advice on how to fix it every single time.
That. My biggest advice is don't give advice.
100%.
Just listen.
Sometimes just listen. Just go, sounds really shit. What do you need from me right now? That is all that I need to hear 99.9% of the time. If I want advice, if I want a solution, I will ask you. I've probably already researched it and I'm probably sending it to you for an opinion to say, is this something that you could support me trying? But 99.9% of the time, I just need a listening ear. If you're going to give me solutions to try and fix it, I guarantee you I've probably already done it. I've already probably been outside and sculled 3 liters of water and touched the grass with my bare feet and had every salad under the sun to try and fix it. Some of which have a place, not discrediting them at all. But
and I feel like when you come in to see me, I mean, we've done 2 laparoscopies. I don't believe that the first thing when I first saw you was, we need to get rid of the endometriosis. We need to do a thorough laparoscopy. But after that, we've looked at different ways of managing the pain. I think we tried to put it off as long as possible, and then it was very difficult to find that right combination to stop it coming back. And then we did a second one last 12 months ago. Was it 2 years ago?
That was the egg freezing, was 12 months ago. The
Okay, you're gonna
laparoscopy
have
was
to
just
be-
before that. Or it must have been the end of 23 was the last laparoscopy.
Okay, so 2 years, so 18 months ago, and then the egg freezing just after that. And I feel finding getting that combination right is important as well. You just can't go for tablets or hormones all the time. You can't do an operation all the time. Everything needs to be in its place and carefully thought through.
And I think it's a big balancing act, and we're very transparent with each other that we leave it to the last possible minute, which is half of what I'm also going through at the moment. Is I'm about to have back surgery, and then I'm like pushing off endo surgery. I know that soon enough it's going to be on the cards, but it's a balancing act as well of trying every therapy under the sun, every tablet to manage it. But at the same time, for me and so many other people, I'm still a single woman in my 20s. If I was to listen to my body, I probably wouldn't get out of the bed 6 out of 7 days of the week. So it's still learning to do the things that you want to do without letting this rule your life, because there's so many times it can, and trust me, it has its fair share of times that it does, and I can't do the things that I wish I could. But at the same time, I think once you face it for long enough, there's this fire in your belly that you're like, this isn't going to control me.
Yeah. And actually, after the egg freezing, we just took a break from everything.
Yeah. So
you were actually quite well for a while, quite a long period of time without taking anything.
Yeah, that was March 24, came off everything, and I didn't have my first major complications of bleeds until July this year and then August this year, and they've been coming back. But that was, I got over 12 months of, I'm going to say, relief to a certain degree. And in amongst that, we've faced everything else of like abnormal cells and bleeds over the years. So I feel like for me, for that 12 months, that was really important. And it's not the same case for everybody, but since coming off birth control after so many years on it and different variations, like when I had the IUD, I was still on the pill, and then we were doing different combinations. I've had the most mental clarity that I had in a long time. And I think that 12 months was really important. And then for me, the start of 2025 was the year that I knew that my endo was going to come back eventually, and we were going to look at removing some cells on the cervix again. But I knew that 2025 for me was a year to focus on the mental toll of it, because I'd been in survival mode for so long.
Yeah. And I think that mental toll is something that you really can't underestimate. It takes a team. It takes a village to bring up a child. It takes a team to manage chronic pelvic pain and everything that goes with it.
Definitely.
And finding someone that you can talk to. You've found someone that you can talk to, haven't you?
Yeah.
About everything that you're going through and all the issues and the mental toll that it takes.
Yeah. I went and saw a different GP who specialises in women's health, and I sat down with her and I told her, I just had verbal diarrhea of, guess what, this has happened. And I remember at the end of it, I was like, it is what it is though, it's fine. Like I was downplaying it because that's what I've been taught to do. That's what I've done for so long.
Yeah.
And she just looked me dead in the eyes. She was like, you know, you have complex PTSD, right? I'm going to write you a referral. And I was like, oh. And then she said, you need to go and see your normal GP and get your mental health plan done. So I did that. And I said to my GP, this comes with the stubbornness. I would never talk to a doctor like this 10 years ago. But she said, oh, I can write you a referral to go and see a psychologist. And I said, please don't just Google and write one to the top one. I was like, I need someone who specialises in medical trauma, because I can tell you that's the bulk of what this is going on up here is from my health. It's not any other factor of my life. And then my health, anything else that happens in my life, it's because it's been in a time of my poor health and I've put a negative impact on relationships or work or something like that. It all stems from this. And I said to her, I'm not going to see someone who's going to give me all of the things to fix it. They have their place. And I did that years ago when I was on antidepressants and trying everything, when I thought I was losing my mind, that something was wrong and I was feeling pain, which once you went in, it wasn't in my head. It was in my pelvis.
It was there. It was real.
So yeah, I saw a new psychologist who specialises in medical trauma. And I remember sitting down and she said, what brings you in today? Tell me the whole story. And I was kind of like, how long have you got? Because there's a bit to unpack in the last 10 plus years.
But you're not going to go through it in like the first time you meet her.
Exactly.
It's going to be a story that evolves.
So once I
started.
And
how amazing to find someone you can talk to and you can trust.
And I remember I had verbal diarrhea and I just told her the basis of what happened, same as what we've done today. It only just touches the surface. There's so much in between all of it. And she just looked at me and she just started crying. And I was like, oh my goodness, she's gonna sook out. Like she's not ready to deal with me. And she just looked at me and she was like, I've got you. Like I can hear you and this is valid and you're allowed to not feel okay. And I remember just sitting there bawling my eyes out and thinking, wait,
I'm being validated.
I don't have to show up and be strong. I don't have to be there for everybody else. Like this is the one spot that you're here for me. Same as when I walk into your office, you're there for me.
I'm glad to hear that. I'm glad to hear that you can feel that's a safe place.
But you don't get that everywhere you go. And I look back on some of the situations that I've been exposed to where I was just in survival mode, trying to understand, and I was so naive, I didn't understand anything at all. Whereas now I'm like, it took a long time to get here and have a team that I can trust and learn from. But if I can learn something from it and share it with other people as well, I think that's really important too. Before I had a team who really understood me and I can learn from, I don't think I had anywhere near the depth of understanding that I do now. And I mean, it must be crazy for you even looking back on poor innocent me the first time I walked in versus now. But can you explain for anyone who might be at the start of their journey or trying to understand it for someone else, what is endometriosis?
So endometriosis is an inflammatory condition. What the pathologist sees when they look under the microscope is the lining of the uterus, the endometrium found outside the uterus. It can be found, I mean, I'm mainly going to deal with it in the pelvis, but it can be found on the ovaries, on the side walls or the beds that the ovaries sit in, and the base of the pelvis, on the bladder, on the appendix. Look, for some women, it can be found on the belly button, in their lungs. It can really be found anywhere. And it's known to cause pain with a period, pain when women release an egg or ovulate, pain when women have sex. And these are the questions that I ask. Pain when they open their bowels. For some women, pain when they pass urine. Sometimes random pain without any warning. And for some women, it can also cause problems falling pregnant. And these are the women that are often overlooked as well. These are the women who are struggling to fall pregnant but don't have any pain. And they may be told it's unexplained infertility and go through many rounds of failed IVF, but in fact what they need is someone to do a laparoscopy and do a definitive clean out of it, all the endometriosis, all the inflamed areas there. And that's what the principle of a laparoscopy is, to remove anything that is obviously endometriosis or even subtle changes. And we say in a wide local excision so that I capture what can be seen and the microscopic bits on the edge that can't be seen. If the ovaries are immobile, we mobilise them, we remove the endometriosis underneath. If in some situations a woman may need to have some of her bladder or even some of her bowel removed, but that's obviously a very careful discussion at the time in terms of what are her symptoms and what are we going to achieve from it. And some women have both pain and problems falling pregnant.
And what's the link? Why does endometriosis impact fertility? What's the link there?
So there are many different reasons. For some women, they have so much pain that they can't have sex, that they avoid having sex. For some women, it's caused so much inflammation and destruction of anatomy, their fallopian tubes are blocked. Some women have huge ovarian cysts due to endometriosis called endometrioma on their ovaries, and that's impacted their egg supply, the process of ovulation, probably egg quality as well. But a commonly held theory is that there are antibodies in the pelvic fluid of women who have endometriosis, and they've shown this in a lab situation, which are toxic to fertilization and toxic to implantation. And if we remove those islands of endometriosis, we remove those pools of antibodies, and women, we say a definitive removal of endometriosis will improve fertility for about 12 months afterwards, but invariably, if that is what's stopping a woman from falling pregnant, I would get a call within 6 months to say it's worked, I'm pregnant.
Yeah, amazing. So for anyone who, no matter where they're at in their journey, whether they're sick of being dismissed, they're sick of not falling pregnant, or they think they have endo and they want to start advocating for themselves, even though they should not have to, what's the first steps in that? What advice do you have for them?
Find someone who knows endometriosis. So I would say I'm passionate about endometriosis. I'm passionate about fertility. I can see women and give them the whole story, to talk to them about their fertility, about their pain, about endometriosis. They need to find someone who has experience with the laparoscopic treatment of endometriosis, and ideally someone who knows about fertility as well.
Definitely. And correct me if I'm wrong. So when doing some research, normally it would list if your gynecologist specialises in endo or not.
Yeah. No. Look at their website. Look to see what they've done. I think you also, and maybe this can only be something that you're going to find out when you meet someone, but you need to find someone who you feel, like you said, you're in a safe place, someone who's going to listen to you, someone, and I think a lot of the time I just give women the space to tell me their story. I certainly do ask questions to direct them for certain information that I want, but a lot of the time I just give women the space to tell me what they're thinking. And absolutely, at the end I would say, I've done enough talking. Is there anything else that you want to say or ask? And if you can't think of something now, but you think of something later on, write it down and ask me next time, or ring me up, send me an email and I'll get back to you. You need to find someone who has experience, but you need to find someone who validates you, who listens to you, who answers all your questions.
Yeah, and I think it's really important, like you said, writing it down, because my first appointments with you, I had so much information that I'd researched or I wanted to know, and I remember just putting it in my notes app, because any appointment you sit in, there's just 100 emotions. Whether you recognize you're feeling them or not, there's so much going through your brain and your belly and your chest, and you're just feeling everything. And it's so easy, whether it's with your GP or your psychologist or your gyno, or for me, my urologist as well, that you sit down and you go, oh, I've just had this problem. Can we just try and fix it? And I'm like, oh, wait, no, I had 3 other different options that I wanted to chat about. And I also forgot that I needed to tell them about this flare-up that I had, no new symptom that I noticed or something like that.
Write everything down.
Writing it down and tracking it. I'm sure most women are across it, but tracking your cycles wasn't something I was doing when I was 20 because I didn't think that was relevant. But for now I do. So I think keeping a record of everything. And the other thing that's come really helpful to me, and I would hope you don't have to do it, but for anyone who has a lengthy health history and particularly different specialists, different GPs, that sort of thing, I've started making a bit of a health diary and trying to put everything in chronological order and making sure that I save everything, because when you go to see someone or you're trying to look back on everything.
I read all of it. And if someone comes in with laparoscopic pictures, I look at all of them. I look at the pathology. I really make sure I've got a good understanding of what has gone on and the direction that we're going to take.
Yeah, because for me at 20 years old, I just thought, oh, I just get surgery and I'm cured. Like, this is going to be fine. I'm never going to have a problem again. When I meet a partner and I want to get pregnant, we're going to have babies. That's how it's going to work. So for me, that wasn't important at the time. And looking back now, there is, as you know, there's a lot to unpack in my health history. So whether you're expecting a lengthy journey or not, I think it's just important to have all of that together and somewhere in a way that makes it easy for you to understand, just in case you ever have to break it down and go through it as well.
Yeah. You know, the other thing I would say is, if possible, bring a friend into the appointment so that you've got another set of ears listening, and also someone else to ask questions, because a friend might just look at things in a different way. And I understand that you're very independent and everything, but it's just an option.
Yeah, definitely. The ironic thing is I recommend it to other people.
Yeah.
I'm just stubborn.
Yeah, that's okay.
Wildly independent.
What are your plans for the immediate future? Where do you see yourself going in terms of your health and everything?
Yeah, I feel like I never have a plan set in stone. Tomorrow I'm getting back surgery for a new sacral neuromodulator and leads to function my bladder for me. As my friends like to call it, my robotic bladder's just getting some new legs and it's going to work again. But I only found out about that less than a week ago. So I don't like to plan too far in advance, but back surgery tomorrow. So that'll be a nice recovery, forcing me to stop and slow down and reassess a few things. In terms of fertility and endo, I want to freeze more eggs. I've always been very honest about that, and we've chatted about that. For me, I work to try and pay my way with all of my different health costs, and for me it's just saving up to do that. Once I have the funds, if I win the lotto, I'm going to freeze eggs every month for 12 months. I'm going to keep you really busy, but that's yet to happen. Haven't even bought a lotto ticket, so I'm really kind of wishful thinking there. And then, we'll work towards seeing how long I can tolerate endo for, do another surgery. But in terms of my work life, personal life, I'm really enjoying the work that I do in the women's health space. I have so many wonderful women that message me every single day of the week, thanking me for sharing my story, which feels so surreal because me 10 years ago thought I was the odd one out. So the fact that now I can share it so openly, and honestly, I'm an open book. There's nothing that's really off limits for me to talk about.
You're amazing.
So in absolute awe of your platform, and that we can share resources and have a chat about my story.
So on that note, thank you, Brooke, for coming in and sharing your story today, for reaching out to other women, to letting them know that help is available, that things can be done, that there are people there who will listen. Yeah.
Thanks for having me.
My pleasure.